Welcome to Logical Ayurveda. So, today is a very important, very inevitable, and utmost need of the hour knowledgeable video about the importance of Manjistadi Kashayam and the contents of Manjistadi Kashayam, difference between Lagu Manjistadi Kashayam and Brihat Manjistadi Kashayam, where to use what, relevance of Manjistadi Kashayam in the present era, and contraindications of Manjistadi Kashayam. So, when I was doing my UG in Ayurveda, BMS in Ayurveda, I did not know about Manjistadi Kashayam. I did not even remember that I studied Manjistadi Kashayam. When I completed PG, I did not know. Except a few prescriptions in here and there, I did never know about Manjistadi Kashayam. But 4 years into my clinical practice, that time, seeing the result of Manjistadi Kashayam, my pupils started to dilate. What is this Manjistadi Kashayam? How it is magically working? How can he know more about this Kashayam? What can he co-prescribe it along with? What did different Vaidyas have to say about Manjistadi Kashayam? What did my Guru have to say about Manjistadi Kashayam? Then I researched in detail about what magic this Kashayam can do. Because you know what? There is a patient who had a varicose ulcer. Usually varicose ulcer is called non-healing ulcer. So-called non-healing ulcer. This patient went to every and name any multi-specialty hospital you want. He had varicose veins and ulcer. That ulcer could not be treated by any and every of the specialists, vascular surgeons, general medicine people, everyone. He went to everyone. If someone is famous for varicose veins, he has gone there. After going to 20-30 hospitals, struggling for 4 to 5 years, he came to me. And then I prescribed Manjistadi Kashayam along with Kaishara Punanava. The case history is there. I've detailedly presented the case history before in Logical Ayurveda. And then I prescribed Manjistadi Kashayam in 6 weeks. 4 years of ulcer, varicose vein, cured clinically, cured very precisely, cured beautifully. Even for patient, it was magic. Even for me, it was magic. Then I started to learn more and more about Manjistadi Kashayam. What magic can it do? Because if you're an Ayurveda practitioner, I will tell you, if you're especially into treating skin diseases, I will tell you, you will prescribe Manjistadi Kashayam for 1 out of 3 patients that is going to enter into your clinic. That means more than 30% of your patient, you're going to prescribe Manjistadi Kashayam. If you do not know in detail about how to prescribe Manjistadi Kashayam, then rest assured, you cannot have a proper clinical Ayurvedic practice. That much important it is, because you see 4 years of varicose ulcers does not cure, and it cures magically within 6 weeks of Manjistadi Kashayam, and multiple years of fungal infection cured within 3 to 4 weeks of Manjistadi Kashayam, and skin diseases, hypercholesteremias, etc., all those gouty arthritis and associated skin diseases, psoriasis, etc., getting cured by Manjistadi Kashayam, then you will wonder what is the magic inside it. That is what I am going to precisely teach you about Manjistadi Kashayam. First, we are going to see about Lagu Manjistadi or normal Manjistadi Kashayam. That the shloka goes like this: Manjishta Trifala Tikta Vachadaru Nishamrita Nimbascha Yesham Kritatwata Vatarakta Vinashanaha Pama Kapalika Raktamandala Jeenmataha. So, what does Manjistadi contain? Manjistadi contains Trifala, Tikta. Tikta means Katuki. It is taken 2 references. In Kerala, they use Brihati instead of Katuki. In North India, they use Katuki. But I think both are fine. Vacha, Daru Haridra, Nisham, Nisha, Haridra, Amritaha, Guduchi, Nimba, Kritam Kwatham, Vatarakta Vinashanam, Pama Kapalika, Raktamandala Jeenmadha. So, you know what? Manjistadi is so much so skin detox that people just make, so many companies make a sugar syrup of Manjistadi and call it a blood purifier, and it sells like crazy. You can even market it, you can export it, and you can do anything. Because most of the blood purifiers of any and every company which check Manjistadi will be the main ingredient. You can make a sugar syrup of Manjistadi and you can sell it anywhere. Because you see, I will give you an example, like how just commercial mass masala action comedy movies are for common audience. Manjishtadi is a common treatment for skin patients. It is that much relevant for skin diseases. So coming back to the topic, so it contains tikta dravyas like Nimba and Katuki or Brihati, etc. And it contains Pachana, Deepana Pachana dravyas like Haridra, Devadaru, Haritaki, Amrita, Tikta Pachana dravyas. It contains Sramsana dravyas like Trifala. It is a 3-in-1. It has Tikta action that is going to reduce Pitta Kapha. It has Tikta Pachana action and Katu Pachana dravyas like Haridra also. And it has Sramsana action because of the presence of Triphala and Haritaki. So at a time, it can digest the improperly digested food. It can take it out of the body. It can detoxify the blood, and it can do anything. So where it is specifically indicated Manjishtadi, Vatarakta Vinashanaha. Patient comes with gouty arthritis, swelling, pain, redness, uric acid is elevated. There you can use Manjishtadi Vatarakta Vinashanaha. There is this Rakta Varashta Vata, there is Parsha Ashnita, there is pain, redness and tenderness. As I said in an earlier video for Kaishra, there you can use Manjistadi Kashayam. Pama Kapalika, Pama Kushta, Kapalika Kushta. Rakta Mandala Jeenmataha. I will give you two things. Just remember this. Rest in peace. RIP. Manjishtadi Kashayam acts as a RIP solution. Rest in peace for skin disorders. When you give Manjishtadi, all skin diseases rest in peace. RIP. Redness, itching and pain. Pain, it indicates Vatarakta. Redness and round and red. Because wherever this Pitta Kapha is there, the skin diseases are demarcated, are round, just like fungal infection, teniasis, etc. These are round, red, and eye, itching. So redness and round demarcated for R, and itching for I, P for pain. Rest in peace. Remember that. Wherever you have all these criteria, or two of the criteria, you can always prescribe this Manjishtadi Kashayam, definitely. And it is told, Pama Kapalika Raktamandala Jeenmataha. You see, whenever this fungal infection, another scabies, all those skin diseases, when it is acute or in subacute condition, you can see redness. In Pitta Kaphaja stage, you can see that redness. Whether it is Pittadika Kapha or Kaphadika Pitta, there you can see redness. Definitely in that particular condition, you can prescribe Manjishtadi. But after a while, when it becomes chronic, when Vata dosha increases, then it becomes black. Or if they apply a steroid ointment, then it becomes black. So there some other Kashayam like Mahatiktam can be useful. But in initial stages, definitely in acute stage and subacute stages, like Manjishtadi is very much useful. Because Pamakushta is told, in Pamakushta it is called Sweta Aruna Shava Kandula Pidaka Brisham. Shweta Aruna, redness is there in Pamakushta also. There you can use Manjishtadi. Kapalika, Krishna Aruna Kapalamam Yatruksham Parasham Taranu. Krishna Aruna, underline the word Aruna, redness. Yatruksham Parasham Tanu, there you can get. Rakta Mandala Jeenmataha, redness means Manjishtadi. Manjishtadi is red. You know what is funny? Manjishta was used in food and in textile industry as a red color dye. Indian matter it was called. It was used as a red color dye in textile industry. So definitely when you name the word Manjistha, red color should come to your mind, which almost translates to acute and subacute stages of all kushta. There are several contraindications, and I'll come to that at last. Rakta Mandala Jeenmataha, Rakta Mandala Kushta. Which are Rakta Mandala Kushta? Teniasis, every teniasis is Rakta Mandala, scabies is Rakta Mandala, and some of the psoriasis like dental psoriasis is Rakta Mandala, nemular eczema is Rakta Mandala, atopic dermatitis is Rakta red, contact dermatitis Rakta Mandala, impetigo Rakta Mandala, tinea pedis, erythemas, rosacea, everywhere, all the skin diseases, depending on the condition, you can always prescribe Manjishtadi. It is that much versatile. I am telling you, you make a sugar syrup of Manjishtadi, you make a product, you can sell it all over India, and you can make crores together of turnover, you can sell it in abroad also. Just to mix sugar syrup to Manjishtadi, that much is enough. So in Visha diseases, Visha because of skin diseases, because of Visha or allergies, I give Manjishtadi, Vilvadi and Avipatti Churnam. In Pitta Kaphaja Kushtas, I give Manjishtadi along with, when it is Pittadika Kapha, I prescribe Manjishtadi along with Kamadoga Mukta, Kaishra Sariva Aswam, Avipatti, etc. When it is varicose ulcers, definitely I prescribe Manjishtadi along with Kaishura and Punarnava. When it is fungal infection, note this, it is very important. When it is fungal infection, any form of fungal infection, I give Manjishtadi along with Kaishara Gugulu, Gandhak Rasayana, the importance of Gandhak Rasayana, refer to the earlier video, and Triphala Pariseka, Triphala wash externally, and Gandhaka Malahara external therapy, or I'll give ointment 6C or any ointment which contains Gandhaka. That much is sufficient. So in next video, we are going to see the differences between Manjistadi Kashayam and Maha Manjistadi Kashayam.